Welcome back to Dr. Sellers Educate. We're happy that you're back as you continue on your journey to achieve certification, or you could be on the journey to renew your CNE. And we're delighted if that's you because we want to celebrate your great success. And we are also wanting to announce our new program focusing on our nurse educator colleagues that are on that journey for renewal. We know that there are quite a number of requirements that NLN has identified and really outlined for us to follow in order to ensure that we achieve a successful renewal certification process, okay, and approval by NLN. We're launching that new program on April the 7th. We have some information right here in our description about that new program if you're watching us on YouTube. If you're listening on our podcast, we have information there as well. All right, we hope to see you on April 7th as we launch our monthly workshops for those of us that are on our journey to renew our certification. Now, in this episode, we're continuing our Snapshot series, focusing on the who, the what, and the how as it relates to learning theory. We know that learning theory is a heavy focus for the CNE exams. And remember that when we say CNE, that's a generic term we use. It's applicable for CNE novice as well as for CNE clinical and our academic nurse educator certification as well. And we want to make sure that you have those resources in front of you that's going to help you close your knowledge gap. So you want to pull out Billings and Halstead 6th edition. Page 248 is where you're going to find the behavioral learning theory information and really the content that you will need to dig deeper into as you move forward on your journey. And then Appendix A in Dr. Caputi's review book, if you are on your journey for the CNE or CNE novice, you already have the red book. And if you're taking the clinical, just make sure you have Dr. Teresa Schallenberger's book in front of you as well. All right, and one last housekeeping tip. Go ahead and print out your study worksheet. If you have not done that yet, go ahead and pause this video and come back whenever you're ready. You want to make sure that every single time you show up for a snapshot, that you are using the resources that are going to help you stay focused and move forward on your journey, okay? And if you have your study workbook, we have those available for CNE. CNE novice is the same one as CNE and CNE clinical. The workbook is specifically designed to maximize the time that you have and to keep you moving forward in a structured way to make sure you close your knowledge gaps. That can be one of the biggest challenges that many of us have experienced on our journey, and that is staying focused and being clear with structure about how you're going to close all of your knowledge gaps related to the competencies. All right, so this snapshot series, we're focusing on Watson and the behavioral learning theory, the who, the what, and the how, okay? We started last week with Kolb's experiential learning theory. So if you haven't seen that episode, we want you to go back. You can pause this one or finish this one and go back and look at Kolb's experiential learning theory as well. All right, so we're going to start with our practice question like we always do. If you haven't seen it, make sure you look in the description of this episode and take some time to review the content that we're going to talk about today. So Jane Watson's caring theory focuses on the integration of respect for caring as a means to develop relationships and trust. This is a type of behavioral learning theory that focuses on making observable changes to behavior. So which teaching strategy would best align with this theory? We have A, the nursing student is asked to list the dietary restrictions in the patient's record. B, nursing students are assigned a discussion to describe the caring principles. C, the nursing students and faculty introduce themselves on the first day of the clinical experience. Or D, debriefing about what went well during the clinical experiences and what should improve. And now we're going to take a little bit, we're going to take some time to review content related to the what. So what is behavioral learning theory? What is Jane Watson's caring theory? And how does it relate to teaching strategies that we want to ensure we're implementing aligned with the evidence? First of all, the competency alignment coincides with learning theory, facilitate learning, and facilitate learner development and socialization. I also want to point out that now our workshops and our monthly boot camp also offer contact hours, and we align it directly with the competencies. That's very important, as you all know, for anyone who has already renewed their CNE certification. Okay, that is a requirement that we'll be talking more about during our workshop. If you chose C, The nursing students and faculty introduced themselves on the first day of clinical experience. You are correct, so give yourselves a round of applause if you chose C. The reason why C is correct, remember that you always want to ensure that you're understanding the rationale for the correct answer and the incorrect answer. So this specific option C is aligned with Gene Watson's caring theory processes or principles under establishing a trusting relationship. Caputi also is a good reference for you, Appendix A and Billings and Halstead, page 248, as we mentioned. Okay, so let's go back and talk about the rationale for A, why that's not correct. So the nursing student is asked to list, okay, so that's not an observable behavior. Can we see that they wrote out the dietary restrictions? Yes, but the best alignment is not A. B, nursing students assigned a discussion. That's great, right? That's going to engage in some socialism perhaps and some cognitive evaluation perhaps. But again, there's not a behavior, a direct observable behavior associated with the discussion. And then D, debriefing. Well, that's good to do as well. That's a great best practice, right, in the clinical setting. However, it's not the best teaching strategy that's aligned with the theory of that we're talking about, which is behavioral learning theory. Okay, so again, you make sure you understand the rationale as to why each response is correct or incorrect. All right, so let's take a look at some of the content related to Gene Watson's work after we take a look at this testimonial. We shared this testimonial from RLT, Dr. RLT, and he shared with us that after 2 unsuccessful attempts to pass the CNE certification, to say I had grown discouraged and self-doubting would be an understatement. Thanks to Dr. Sellers' Educate, I gained the confidence and competence to finally pass the exam. As they say, the third time's a charm. Well, sort of, as my charm was Dr. Sellers. Her program works. Well worth your money. We appreciate, as always, the feedback that we hear from you all. And that's exactly what we want to do. We want to chart our success. We make modifications or revisions to our curriculum, just like we do in our universities and our nursing programs. We make adjustments and revisions based on feedback. So we love hearing your feedback. We've made quite a number of adjustments based on feedback we've heard from you all up until this point. So your feedbacks are always welcome. Who is the content that we want to cover next as we wrap up our snapshot? So Gene Watson, if you're not familiar with her work, highly encourage you to take a look at Gene Watson's work, specifically related to the theory of caring. Her philosophy says that nursing, and her work says that nursing must build a strong foundation to consider respect for caring as a means to develop those relationships and trust amongst all parties in the healthcare system, okay? And some of these tenets associated with her work that is strongly aligned with our teaching strategies include ensuring that we are effectively communicating with our students, engaged in demonstration of active listening skills. So what could that look like? Us sitting when we talk to students, us giving them eye contact, right? When we're in class with them, when we are meeting with them one-on-one, making sure that our door is closed and that we have direct alignment with our students' posture, so that again, we're demonstrating these active listening skills. And those are very similar to what our students are engaged in regarding the patient and the family experience, right? We want them having direct eye contact. We want them, when possible, sitting to talk to the patient. And then lastly is going to be the interactions and demonstration of respect. So we can do that by knocking on the door before our student actually enters the room, our students introducing themselves. And it's the same thing based on our practice question when it comes to us developing that healthy, trusting relationship with our students. Introducing ourselves, helping them better understand who we are as a clinical faculty member, that we are here to support their success. And then in turn, we want our students to introduce themselves as well, because we do establish a strong sense of community in the clinical setting. Okay, and then last but not least is the how. First, we want to think about, how do our students bloom? How do they grow, right? How do they scaffold their learning? How can we support and coach them to help them scaffold their learning over time? What you want to make sure you understand are going to be the verbs associated with the higher level of Bloom's taxonomy. specifically looking at application and being able to analyze as students move quickly towards that evaluation phase, right? Because we want students to be able to apply the clinical skills that they're learning in the classroom, to analyze how patients respond perhaps to an intervention, and then evaluate the outcome of that intervention. Okay, so we want to ensure that we are incorporating objectives that are based on the learner's needs, and that we are evaluating and validating that learning has happened for each of our learning objectives. How do we evaluate? It is by demonstration. You can see some of the great caring behaviors that this assumingly nursing student is demonstrating, okay? So we saw, if you want to just pause the video right now and write down some of those behaviors, but we saw her give direct eye contact, right? We saw her smile. We saw her seemingly be very patient and intentional in her movement as she was caring for this patient to move them to a new location in the wheelchair. So just think about what behaviors we're able to observe with a healthcare partner or nursing student in this example, to ensure that we are tying back and aligning the care practices and the behaviors that we see with our students, giving them that feedback continuously, so they can improve or make any corrections to their care delivery processes and provide better patient care. Okay, so hopefully this snapshot has been helpful as you continue on your journey. Make sure you print out that worksheet. This is our contact information so that you can reach out to us if you have any other questions. If you are on your journey to renewing your certification, do not delay any longer. I know we have 5 years, but if you're unsure about the number of contact hours required, how you align the content to each of the competencies, we are here to support your success. We don't want you to lose that certification that you have worked so hard to achieve. And for those of you on your journey, make sure you stay tuned for more updates as they come out every single week from Dr. Sellers Educate. All right, until next time, have a great one, everybody. Bye-bye.